So the workshop focused on the role of the reference lab for medical mycology in England. It was given by Public Health England, and it comprised a mixture of lecture components and diagnostic testing within a laboratory setting.
We saw a lot of those diagnostic tests in action, and we got some hands-on experience in the identification of pathogenic moulds in the lab. And I think some of the things I took away from it were the range of tests that are available that they can do in the reference lab, and what actually happens to samples as a clinician, that I'm sending down to the reference lab. It was nice to see that process.
For me, as a clinician, it was really nice to be reminded of the clinical slant to the work that we're doing here in Aberdeen. So it was nice to witness the clinical specimens that they were processing and how it differs when you have a time pressure and a clinical pressure on you, and you still have to use the same diagnostic test. So I think for me, what was really lovely about the workshop was it reminded me of that.
First, they showed us how you do microscopic analysis, specifically of mold fungus like Aspergillus, because they're easier to identify under the microscope, unlike things like Candida. And then they also told us about susceptibility testing, so the resistance of the species that's been obtained from the patient to each drug, and that drug can be specified by the person who's asking for it, which drugs they want to know the resistance against.
The main challenges we face would be the diagnostic side. So the diagnostic tests that we've seen as part of the workshop in Bristol, they're quite a lengthy process. That is a big problem, especially if you've got an invasive fungal infection that's systemic, leading to things like sepsis. You're going to want to treat that rapidly. And then following on from that is the availability of antifungal drugs out there to combat resistant species.
And I know what it's like to be on the coalface and with a patient and not be able to give them an answer, not be able to tell them what's wrong with them. I know the frustration that brings. What I think was lovely for both myself and for then my academic sort of sciencey colleagues to see was that. And that the biggest challenge for us really is diagnostic tests which have a quick turnaround time, which are cost effective, which are easy to do.
The most eye-opening bit of information I learned was the amount of samples that they get from patients across the UK, because there's only 3 mycology diagnostic labs in the UK. This one we went to in Bristol, and they said that they got thousands of samples for superficial infections, and that their samples that they receive for susceptibility testing has increased massively over the last few years. So a couple of years ago they would have about 10 samples a week, and now they have more than 40.
I think one of the sort of key things I took away from going to the course that I wasn't expecting was that although there's lots of new technologies coming through, some more high-tech things like the multi-tuff mass spectrometry that we saw for the species identification of yeast, there's still a really sort of indispensable and key role for direct microscopy and simple culture techniques in medical mycology, maybe more so than some of the other aspects of microbiology. And I think having knowledgeable people in the lab is so important in identifying these pathogens. And although these other techniques, if you know how to use them, can add a lot and be helpful, having that basic knowledge of being able to do direct microscopy and identify the pathogen in the first place is really important.
So I think it's important to attend this course, because then you get to see how diagnostics are run, you get to see the challenges firsthand, and if you know the challenges, then you can think of ways to get around them when you're working in your own research. Also, if you are working in a research-based lab, it's quite nice to see a different kind of lab. So this is like a clinical-based lab that uses patient samples, which is very different from the research kind of labs that we work in, using different kinds of samples.
The Public Health England workshop gave us a broader view, or kind of broader array of fungal disease that's seen going through the clinic. So it kind of maybe filled in whatever gaps were in our knowledge, kind of give us a bigger depth, and also kind of showed us as well that the work that we're doing here in Aberdeen, how important it is, and how it translates not just within the clinics in the UK, but also globally.
I think I have sent, certainly in my own practice, I've sent samples to Bristol, and I had a really limited understanding of what actually happens to them when they get there. So for me that was lovely to see. I've certainly sent drug teachers and things for analysis to Bristol, and I've actually, but having never visited the lab, I had no idea how those results come about and then get sent back to me. So I found it very informative from that point of view, and I think it's important for us all to be involved in, even if we're never going to be involved in clinical work, for us all to be involved in understanding the clinical relevance of what we do. I think that makes us better researchers. I think doctors are good researchers because they understand the clinical implications of what they do, and I think researchers will be better researchers if they understand that too.